Hello everyone, I'm Dr. Sachin Korastani from Lotus Medics. We bring you another very important educational video on women's health. The topic we're going to talk on today is menopause and menopause management. Menopause is a relatively new phenomenon. As we have increased our life expectancies, women are spending more and more time in a phase of their life where they don't have menses or where they have stopped their menstrual period. This is menopause. We don't talk very much about menopause, and very often this is a neglected topic. Often women have certain myths about menopause, and thanks to a lot of media fear-mongering, there's been a lot of ignorance on this topic and there's a lot of myths around it. Today we're going to talk a little bit more about dispelling some of these myths and getting you some really good quality information so that you can make an informed choice about what you want to do about your symptoms of menopause, what is menopause, and how it can be best managed. Menopause is a natural phenomenon. Menstrual periods start at the beginning of adolescence at a time called as menarche, and as the ovaries get near to the time that they stop their function, that's basically the time that we call as perimenopause or menopause. A lot of the myths surrounding this is, oh well, this is natural, it doesn't need treatment, and this is not entirely true. A lot of other myths surrounding it say that HRT will cause cancer, and again, that is a myth that has been debunked by a reappraisal of new evidence around the menopause trials that were done about 20 years ago. So what is menopause and what do we need to do about it? Well, there's a couple of definitions we need to understand. What is perimenopause and what is menopause? Perimenopause is a period of transition between normal menstrual cycles and complete cessation of ovarian activity. That can be quite a few years, somewhere between 10 to 15 years. It involves a lot of fluctuation of hormonal levels, and often women may have varying periods and varying symptoms during this time. Menopause is defined as complete cessation of ovarian activity and usually is a period of 12 months after the age of 40 with no contraception when a woman does not have periods at all. Globally, menopause usually happens on an average at the age of 51, but this can also happen either earlier or later. If this happens really prematurely, that is before the age of 40, it's called premature menopause. If this happens, this can have quite a significant devastating effect on bone function and cardiovascular function and certainly may require treatment. It may be difficult to diagnose someone in menopause, especially if they've had a hysterectomy or have a Mirena or may have had an endometrial ablation, as the usual menstrual cues which are present in most menstrual women are absent in this population. What do the ovaries do? The ovaries secrete important hormones like estrogen, progesterone, and testosterone. After menopause, the secretion of these hormones is affected. All of these hormones maintain genital tissues, hormonal balance, ovulation, sexual function, and are also important for maintenance of bone mineral density, cardiovascular, and cognitive health. Let's look at some important things. How do you know if you have menopause? And one of the important questions I get asked is, Doctor, do I need a blood test? Well, you don't always need a blood test to diagnose menopause. And in fact, in perimenopause, because of a wide fluctuation of hormones, there can be a huge fluctuation in the hormonal blood test levels. So blood tests may not always be significant or helpful. Also, when we look at the success or the efficacy of hormone treatment, often blood tests are not very helpful either. A lot of the efficacy or success of these regimes of treatment are often judged on how they help resolve your menopausal symptoms. Looking at symptoms, there are two types of symptoms of menopause. The first symptoms are those of estrogen withdrawal. Often these symptoms, like hot flushes or night sweats, will get better with time. The second type of symptoms are those of estrogen deficiency. These are things like vaginal dryness, loss of libido, and these will only get worse with time. 20% of women will not have any symptoms of menopause and will transition into menopause very naturally with no impact whatsoever on the quality of their life. But 20% have quite significant symptoms that can really impact their life. 60% of women will often seek treatment because most of the symptoms of menopause are certainly affecting their quality of life. So this is, in short, a breakup of the type of symptoms of menopause. On an average, menopausal symptoms, especially the vasomotor symptoms, can last up to 6 to 7 years. Sometimes they last longer, sometimes they get over quicker than that. Menopause also has long-term implications, those on bone health and cardiovascular health. But a lot of these are multifactorial. What can I do before starting hormone replacement? Well, the first thing obviously is to make sure that you're up to date with things like cancer screening, your cervical pap smears, your breast screening, and any other cancer risks, trying to see your GP and trying to get yourself screened for any of those risks. If you've had any abnormal or unscheduled bleeding or heavy bleeding, please consult your doctor, and this will certainly need to be investigated with a pelvic ultrasound scan to check the endometrial thickness and also rule out any endometrial polyps, or also screen for endometrial cancer. Do not, and I repeat, do not use any hormone replacement therapy if you've had any postmenopausal bleeding or any unscheduled bleeding. Women who are on existing HRT need to immediately stop their HRT and consult their local doctor, the GP or the gynecologist. There are some important lifestyle management changes that you can do. For example, cut down or stop smoking, reduce or have alcohol in moderation, reduce your tea and coffee intake, make sure that you control or reduce your weight, start exercising, which has certainly got a beneficial role in overall health management and certainly also improves symptoms. Some people might want to adopt more breathable clothes and natural fiber clothes, which will certainly help them with certain symptoms like hot flushes and sweats. I also wanted to answer this oft-asked question: is HRT really safe? There were a few trials done about more than 20 years ago, like the Women's Health Initiative and other trials, which really put the fear of HRT into women's mind. Add that with a bit of media fear-mongering, and not just women, but even doctors were absolutely petrified of prescribing HRT. All that has changed since this evidence has been reappraised. I'm a member of the Australasian Menopause Society, and at its website, menopause.org.au, you can find some really helpful information that tells you about the safety of HRT. HRT is very safe and is safer than a lot of conditions. For example, did you know that if someone had a BMI of more than 30 and was obese, their risk of having breast cancer was 24 extra cases per 1,000 women than if you used HRT. The risks of certain other conditions, for example, if you smoked or if you had more than 2 units of alcohol per day, the risk of having breast cancer with these conditions is higher than if you used hormone replacement. So these are just some examples to illustrate that taking hormone replacement therapy is very safe and does not cause risk like ovarian or breast cancer or a lot of other risk factors that have been mentioned and fear-mongered in the media. I would urge all of you to go to menopause.org.au and to be able to read the important information and view some videos by experts which basically will dispel these myths about the safety of HRT. So let's come to what HRT should I use? Well, at Lotus Medics, we tailor HRT use to your personal customized situation. This will depend on several things. It will depend on the symptoms, it will depend on how much each symptom affects your quality of life and what you would like to focus on. It will also depend on if you've had any previous comorbidities or any previous cancers. In short, in a normal healthy person, if they have a uterus, then estrogen and progesterone is the best HRT to use and the most recommended HRT to use. If they've had a hysterectomy, they only need to use estrogen HRT. But that's just a very simplified, easy to understand way of putting it. We, as I said, will be able to look at your individual situation and customize and tailor the HRT which is right for you. This includes both systemic HRT, but also includes local HRT like vaginal estrogen in women who only have local symptoms or have local symptoms in addition to the other systemic symptoms of menopause. And in addition, in women who have had certain comorbidities or certain gynecological cancers where systemic HRT is contraindicated, there are certain other forms of HRT which are non-hormonal HRT which we can also prescribe and use for these women to improve their quality of life. So in short, HRT is a choice. If you are significantly affected by menopausal symptoms, if it is affecting your quality of life, if it is affecting your relationship with your partner or your husband, please come and see us. We will review your individual situation, we will optimize your health, and we will tailor the HRT which best suits your symptoms to help improve your quality of life. Thank you very much.